This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. In thinking about characteristics that would make up a good CRNA, can you touch on some of those tips for success that you, and kind of advice that you would normally give to your new CRNAs?
For sure. So one of the main characteristics that I try to talk about is being humble and honest. Mm-hmm. And so we come fresh out of school. It's not dissimilar to being a brand new ICU nurse. Mm-hmm. Somebody's going to come in, a cardiologist is going to come in, he's going to rattle off something, he's going to ask you some questions, and we're going to be like, yeah, yep, I'm following you, I know where you're at, and I have no clue what we're talking about. Mm-hmm. So that's one of the things that I try to tell everybody is, there is no fake it till you make it in anesthesia school, or an anesthesia practice. If I don't know something, I need to be open, honest, and humble. And they're like, well, I'm going to look like an idiot. It's like, that's better than hurting somebody. Or, not establishing a level of trust, and that's what I try to tell people that are starting out is you're going to get more respect by saying, please forgive me. I know I should probably know this, but I'm completely ignorant to what you're talking about. Would you mind educating me real quick? Most of the time when you take an approach like that, you establish a level of trust of, okay, this person is being honest with me, allowing themselves to be vulnerable, but creating a teachable moment for themselves. Yeah. And then that surgeon, let's say I'm talking to a surgeon, that surgeon knows, okay, when they're in my room, I'm not getting any BS. They're going to be honest with me, and they're not going to be just going through the motions.
Right. That's really important.
So that's one. Another that I just harp on all the time is having a good work ethic. And what I mean by that is somebody is purchasing time in our day. And so we need to be using that as efficiently as we can. Yeah. And in anesthesia in particular, it matters because if you can run an efficient room, the day is going to go smoother and you're going to finish earlier. Mm-hmm. Okay. And it sets a mindset of, okay, I'm coming in on the day and I'm setting the tone. We're going to come in, we're going to work hard, and then we're going to go home to our families. Mm-hmm. And then probably other third thing that I really harp on is being a good teammate. Yeah. All of these things sound just so basic and foundational, and they really are, but they cannot be overstated. Yeah. And what does a good teammate look like in an anesthesia group? Okay. Mm-hmm. Not complaining about assignment. It's easy if you start looking, in the ICU, it's the same thing. I've had this patient 3 days in a row. Mm-hmm. Who's picking on me? Why am I in endo again? I did that yesterday, and it's just playing our part as a team, making sure that if I've got some downtime, let me go find somebody who's in a busy room and offer them a break. Maybe they need to step out, make a phone call, get a shot of water. God forbid, have a decent lunch break. Yeah. And so if you can put those three things together, that's really going to take you a long way, especially in the first 6 months on the job.
Yeah. One of the things that resonated with me was the point of taking extreme ownership and accountability of your actions, something that you would put in your PowerPoint. I just thought that was so, it's very much, a part of a well-oiled team, and being completely honest and transparent is figuring out exactly where you went wrong, and the fact that you are accountable for those things that have happened. Or even if you felt like, other people were too, understanding what your piece was in, that puzzle and order, to troubleshoot for next time. I think that was such an important thing to take away.
Absolutely. I couldn't agree with you more. I wish I could take credit for that, but that's actually Jocko Willink, who was an ex-Navy SEAL. He retired from the military, now he does like leadership conferences. He has a book called Extreme Ownership. And the idea of that is, if I approach a patient as, this is my patient. If I approach my job as, this is my hospital. How would I treat this patient if my name was on the front of it?
Yeah.
You know?
Yeah.
And then also looking at problems in that same manner of, well, that was an ancillary service. That doesn't have anything to do with me. Well, no, that was my patient. Did I communicate with them appropriately? Did I provide rapport to where they understood why we were, implementing these measures and why it was not appropriate to stop those medications, you know? And it kind of comes also with the idea of like, if not me, then who? If not now, then when? Yeah. You know? And those are the two questions. No, if it doesn't have to be anybody, it's going to be me. When? Now. You know, we're going to address it, and I'm going to take ownership of it and try to steer the ship in the right direction.
Yeah. I think, like I said, I think that's one of the biggest things on a well-oiled ship is everybody taking accountability in that way, and things just flow much smoother instead of, people that kind of float in and out. It's kind of hard, might not have that same like work ethic. And so just instilling that early on, I'm sure your rooms flow much smoother, and then you have a much more efficient.
And if you have a team, especially a team, not just one individual that really takes on that extreme ownership, and you have a debriefing after an event. Let's say it was an event that truly and honestly was going to happen no matter what. Yeah. Okay. Well, if we take extreme ownership of it, and we say, I could have done it, maybe this would have, played a different part. If you have 5 people doing that, I guarantee you're going to stop an event from happening for some other patient in the future. And everybody's going to just have a better rapport going forward. Yeah. Our process is going to be better. And 9 times out of 10, you'll find an ancillary side piece of information that sparks an entire protocol and drives, efficiency in another way. Yeah. You're like, we weren't looking to find this, but we noticed that on all of these we were doing X. Yeah. And so now we're doing this, Yeah.
Just makes everybody more comfortable and feel safer too, I'm sure.
For sure. And it creates an environment where people feel like they can openly and honestly discuss what's going on, and they don't feel, as nurses, for whatever reason, it was always like just punitive measures, like just burned in our brain, and it's like medication errors, it's going to happen to you, and like, and it's like, you're always afraid to like discuss, some things that it's like, no, I don't want to say anything, like, but the way to improve these things is to openly and honestly discuss them.